Tragically, I'm the only one who does not have a medical degree. Let me introduce two friends of mine, Dr. Felix Cabrera and Dr. Roger Martinez, two gentlemen I've talked to, interacted with, even seen as a patient over the years and everything. So, doctor, it's very good to have you here.
Thank you. Thank you.
Okay, and Felix, this is interesting because the reason why we're sitting down here tonight is you are giving what I see as a groundbreaking landmark presentation on the way you approach applying medicine to your patient. Tell me all about it, because I can't do it justice. Let everybody know what you're talking about.
Well, you know, the title of a talk that I'll be giving at the Guam Medical Society actually is the first meeting of the year. And so, you know, I had been asked by the society's president, Dr. Leong Guerrero, if I could give a presentation. And in fact, I gave three different options. One was a very academic talk about updates in hospital medicine. Another one was updates on care on the island. Then I gave this third option here, which is, the title is Reality Divided by Expectations Equals Happiness. And that's the one that the committee had chosen for me to give. And so, because I think it was a very different approach in terms of what we're used to during these presentations, where it's considered a continuing medical education event.
And the crux of your presentation is that, you know, as physicians, you should kind of go against the traditional training of, you know, not being attached to your patients, not having that transference of emotions and everything like that. You actually should, you know, take a little bit of an emotionally vested interest, right?
I think that's where I don't have the right answer to that, and I think that's still being debated and being explored and being researched. In that, you know, part of what this talk is making sure it does is that it understands that us as physicians, we're still very much humans, and we have our own emotions and we have our own illnesses, and how do we incorporate that you know, that transference and in a sense where it doesn't become destructive within our own. And so part of the premise of this is just really understanding and acknowledging the fact that that depression rates in physicians is much higher than the general population. If you look, about 6% of the general population have suffered a major depression episode, whereas in physicians, you're looking at 30% either have diagnosis of depression or have depression symptoms. So that's a stark difference in that. And the really sad stat to share is that every year in the United States, 400 physicians commit suicide.
That is alarming. So very, very short before I get to Dr. Martinez. So you're proposing like almost a framework that physicians can apply for almost like a coping mechanism? Or?
Exactly.
Okay.
I think, and that's where I try and walk the listener and the viewer through the steps in how do you reevaluate what your reality is. Reality is, you know, essentially your perception of what life is, and is that a quality perception, and then your expectations is basically, you know, is that something that is in line with what should be really expected and what you assume life should be. If you adjust that, so it's an equation, the more quality your reality, the lower your expectation, the higher the ratio.
Right.
And then the ratio being equal to your happiness. Okay.
Well, Roger, of course, you, as a fellow physician, is it really unavoidable for people in your profession that, you know, you do on an emotional level take your work home with you, because you're diagnosing people, prescribing medications, seeing people who are suffering, seeing people who are dying and everything like that. Is that just part of the job?
I have a little bit of a twist in my background. I started as a medical student back in the 90s and was on track to become a medical physician. I actually now am a doctor of chiropractic, and I'm an allied health professional. So my take, I kind of see there's a little bit of variance in the way I perceive my level of satisfaction in how I deal with patients, and in my case, I'm working in the hospital, working and doing rotations in the hospitals. You're dealing with sick people. You're dealing with people who have a lot of heavy medical issues, and it wears on you as a human being. You know, you're a physician, but you know, you're a professional. But at the same time, when you have to deal with palliative care, you know, you're having to take on some of the emotional response. You know, we can't be robots. There's no way as a physician we can be absolved from any kind of emotional response to the patients and their families, particularly when it's having to deal with someone who's in death and dying or in a serious matter.
Okay.
But as a chiropractic physician, I'm in the wellness model, so my perspective is more focused on getting people in a place where they're improving their health through whether the modalities that I provide as a chiropractic doctor or through the various allied professionals, the massage therapists I have in my practice and so on and so forth. So I'm there to take away the pain. And in instances, it's more specific to my specialty. So therefore, my sense of well-being and sense of interaction, I tend to be a lot more, I see my patients a lot more often. And so I tend to have a little bit more of a relationship and not necessarily emotional tie, but being a small island, you tend to see people more often than not. Here in my profession, I see my patients quite often. I mean, I've seen you several times through the course of
Yeah, and that's an interesting dichotomy that the two of you have, as well as a relationship, because you're both peers in the medical community. And so, Felix, I'm wondering, as I understand it, you have not published your theories yet in like American Journal of Medicine or anything like that.
No.
But I'm sure you've shared this with some of your colleagues already. And so, like, even if it's like an unlimited population like that, how have they received it? And what kind of criticism have you also gotten?
Well, the first time I actually presented this was at the Guam Nursing Association, their conference back in November. And basically, I geared the same talk with the same principles toward the struggles that nurses deal with almost on a daily basis. And so it was something that was, I like to say, was very powerful for me. And I think that's exactly what the audience felt as well. And that I had one of the nurses come right up to me afterwards who was almost not going to come to the event that morning. And she was a somewhat recent widow, and she had been going through her own transition in life and trying to move on, and with tears in her eyes, and which made me water up as well, is that it really connected with her, and it gave her what she had said to me was more of a framework of how to move forward and how to really understand that happiness is not the destination, it's the journey. And in your journey, that's the byproduct.
Very true. So we can't wait to see when you present this. We can't wait to follow up with you. Please come back after you have presented your findings and everything like that. Talk about us more with what you're doing with Compassion. Well, thank you, gentlemen. We appreciate
Absolutely. And just on the side note, Thursday at 7 o'clock, we're going to have, this is going to be hosted by the Guam Medical Society. And this is part of our continuing education for not only just for the doctors and for the medical community, but also for the public. So if you'd like to learn more information, we'll leave a number to contact us. But it'll be this Thursday at 7 o'clock.
All right, gentlemen. Very well. Thank you.
All right. Thank you.
Please stay